so-called mental health professionals up to? Suicide rates are expected to skyrocket as a result of the recent lockdown, yet rather than speak out against it, they have focused on enforcing compliance with government guidelines and lobbying for more federal funding to deal with the coming epidemic of anxiety and depression. They have also made a grab for political power. The ABC reported in a recent article, Australia's first Deputy Chief Medical Officer for Mental Health will have a challenging task ahead of her as she navigates a pandemic which could lead to more deaths by suicide than from the virus itself, experts say. It's probably worth noting here that the pandemic won't lead to more deaths by suicide. It's the government's response to the pandemic that's going to cause a massive suicides. The article continues, Victoria's former chief psychiatrist Ruth Vine has been appointed to the newly created role, working with Chief Medical Officer Brendan Murphy alongside 4 other deputies, each with their own area of expertise. The Australian Medical Association and mental health experts Patrick McGorry and Ian Hickey have been pushing for the job to be created. They have argued clinical leadership will be crucial in the months and years to come, warning the lasting mental health impacts of the coronavirus pandemic will be felt across the country. Modelling from the Brain and Mind Centre released last week suggested that in a worst-case scenario, which could see unemployment peak at 16%, the crisis could cause an additional 1,500 suicides a year over 5 years. In my previous video, I explained how we might soon be living in an illiberal scientocracy. Now a psychiatrist, another unelected official, has joined the table of scientocratic elites advising government policy in response to the COVID-19 pandemic. Rather than criticising the government's approach, Dr. Vine is playing an active role in engineering the coming mental health crisis. But the problem goes even further. Psychologists are bent on pathologising those who push back against the restrictions causing their mental illness. Take, for example, the following BBC article which links non-compliance with social distancing restrictions and hygiene guidelines to depression. It reads, Those with depression were more likely to flout lockdown rules by meeting up with friends and leaving the house unnecessarily, while those with anxiety were more likely to practice social distancing and regularly washing their hands. Dr. Levita from the University of Sheffield says mental health is no justification for not following the rules, but it might help us understand why it's difficult for certain people to comply. The more someone is depressed, the less compliant and demotivated they are. So if you need to hand wash more often and need to make an effort in following the guidelines, it's not something that you're actually going to be able to do very well. In other words, young people who have virtually zero chance of dying from coronavirus are breaking lockdown rules not because the rules are nonsense, but because they're mentally ill. They're depressed. They're demotivated. Furthermore, they're portrayed as a physical danger to themselves and to society because they could spread the deadly virus. Could this be used as an excuse to introduce Soviet-style involuntary psychiatric treatment of political dissidents? The article continues, The crucial questions are how long this lasts and what support young people need. This situation can have a serious impact on those with pre-existing mental health problems, and some will certainly need some form of psychological treatment. Dr. Levita agrees it's important we don't wait to help young people with their mental health during the coronavirus crisis. If you have a broken leg, you don't wait 2 months before you go to the hospital to get it fixed. Our mental health professionals will need more funding to deal with the wave of anxiety, depression and suicidality they have helped create. So naturally they lobbied the federal government, who pledged $48 million for a COVID-19 mental health plan. Let's watch a short clip from a speech that the government's suicide prevention advisor Christine Morgan gave when Scott Morrison announced the plan.
So this plan reflects that. It understands that. It records that. It says that we do need to look at things such as risky behaviour that so many of us engaging in to try and cope with the pandemic. We need to address those health issues associated with substance use and substance abuse, gambling. We must and we will deal with the issues around violence, domestic, family, sexual violence.
Notice the emphasis on risky behaviour. I suspect this is a reference to non-compliance with government guidelines. Trying to get on with your life as normal is an unhealthy or maladaptive coping mechanism. You'll note she also refers to substance use and gambling. I suspect that part of the motivation behind some state governments restricting pubs, nightclubs and casinos to serving only meals is an underhanded attempt to control people's drinking and gambling habits. Perhaps we are being primed to accept mandatory rehabilitation for alcoholics and gambling addicts. Drunk people won't abide by social distancing rules, and eventually some expert or politician will say drinking in company is as dangerous as drink driving. But of course, psychologists want even more funding. Professor Hickey, who lobbied for the creation of Ruth Vine's role, told the ABC the way Medicare-funded mental health should be overhauled from the current system of allowing rebates for 10 psychologist sessions a year, to support instead teams of GPs, nurses, psychologists and psychiatrists delivering integrated care. Psychologists have been at the forefront of promoting the new scientocratic regime, discouraging us from thinking for ourselves and encouraging blind faith in government experts. Take, for example, this article from Psychology Today entitled "Why Some People Are Still Not Staying at Home," in which the author concludes, "Knowing about the above biases can help us to overcome them. The safest way to proceed during the COVID-19 epidemic is to heed the advice given by our government's epidemiology experts. They have far more knowledge and data than we can hope to gain by trying to figure out the appropriate response ourselves. They may not always get it right, but they will get it more right than any one of us can on our own. This is the time to crush those intuitions telling us we are cleverer than the international experts. We aren't." Psychologists have also been fueling mass hysteria over the pandemic and moral panic over those who won't comply with regulations by writing propaganda pieces like this article, also from Psychology Today, entitled "5 Bad Reasons Some People Still Aren't Social Distancing. These thinking errors are contributing to the spread of COVID-19. As the new coronavirus spreads throughout the world, public health officials have issued strong warnings about the danger we face. For example, Dr. Ezekiel J. Emanuel recently warned that the death toll in the United States could be as high as 2.2 million. But the degrees of illness and death from this global pandemic depends largely on how committed we are to slowing its spread. One of the most powerful tools available to us is limiting contact between those who have it and those who don't. In other words, social distancing. According to Emanuel, these measures could prevent as many as 2 million deaths. Many of us have watched in disbelief and horror as others have defied experts urging to social distance. We might wonder what could possibly motivate people to act in ways that raise the risk not only for themselves but for the most vulnerable among us. What are they thinking, we might ask in disbelief? That is exactly the right question. Once we know what a person is thinking, their behaviour generally makes sense. People do things for reasons, and actions follow from beliefs. But when the behaviour is clearly misguided or foolish, something has clearly gone wrong in the thought process. In cognitive behavioural therapy, we call these types of thoughts thinking errors. The following 5 types of thinking errors can lead a person not to practice social distancing. It should go without saying that these errors don't apply to those who remain in public because of their jobs, like our nurses, doctors, postal workers and grocery workers. I'm filled with gratitude for all of you. The first thinking error is overgeneralizing. When we overgeneralize, we assume that a past experience applies to every situation. Based on this logic, the COVID-19 crisis can't be any worse than previous outbreaks like SARS and H1N1. But past experience is only as useful as it is relevant, and generalizing from other viruses ignores the unique features of this coronavirus, like the ease of transmission and the ability for asymptomatic people to spread it. The better approach would be to bring a beginner's mind, as though it's the first time we've faced this particular disease, which in fact it is. Minimizing, many beliefs about the coronavirus downplay the seriousness of the crisis, such as it's basically the flu, it only affects old people, 80% of people have mild symptoms. Emotional reasoning. Our emotions can give us clues about what's true, but they're very unreliable. For example, we might assume something bad is going to happen because we feel afraid, but in reality it was a false alarm. A person might make the reverse inference for COVID-19, believing that it can't be a big deal because I'm not worried about it. But as the saying goes, reality doesn't care about your feelings, and being unafraid doesn't change the facts about this virus. Fortune telling. Some people seem to believe that they can see into the future, perhaps based on overgeneralizing from the past, and I'm sure this will end up being much ado about nothing. I've heard people cite their experience in previous outbreaks, confident that they know what's going to happen this time around. These kinds of prophecies can be especially appealing when they offer reassurance that everything will be okay. See emotional reasoning. However, none of us has a crystal ball. We have to rely on the predictions of people who know a lot more than we do about this virus and how best to contain it. Entitlement. Finally, the belief that I'm entitled to do what I want can also lead one not to practice social distancing. Some seem to argue that it's un-American to practice social distancing, though coming together to defeat a common enemy seems pretty patriotic. Or a person might believe that not social distancing is like taking off their seatbelt, a personal choice that affects only them. But it's more like taking off your seatbelt and the seatbelts of those most at risk, like your grandparents, for example. If you do recognise any of these beliefs in yourself, start to question the evidence for them. What data support your belief? Is there anything you might have ignored? Is it worth updating your belief and changing your behaviour based on a fuller awareness of the situation? If you do realise you've made thinking errors, it doesn't mean you're a terrible person. That would be another type of thinking error. It just means you're human. It's a truly human gift to be able to question what our minds tell us and change our beliefs accordingly. Align your beliefs with the facts as best we know them, and let truth guide your actions. I wrote the following reply in the comments section of this article. Special pleading. I disagree with the lockdown and social distancing restrictions, although I have to the best of my knowledge and ability observed them. I do agree that we should have a beginner's mind about the novel coronavirus. New data is constantly coming to light. Models and mortality rates are continually being revised. We should always re-evaluate our position in the light of new data. But I disagree with you on the following points. Minimising. You could say that those in favour of lockdown and strict social distancing rules are catastrophising. That's when you sort of make out that the consequences of the virus will be much worse than they actually turn out to be. It's when you magnify in your mind, all the bad things that could happen. Emotional reasoning. Just because people feel that coronavirus is a grave threat to themselves, their loved ones, or society doesn't mean it is. I think most government responses have been driven by mass hysteria. Fortune telling. Even if the experts and their modelling have always been correct so far, and they haven't, that doesn't mean that they always will be. Entitlement. Do those who fear the virus have the right to demand that we prioritise their fear over our own lives and livelihoods? Or to determine which businesses can remain open, what they can sell and how they can operate? Or to determine which jobs are essential or non-essential? What right do governments have to impose lockdowns and social distancing restrictions? What right do experts have to dictate the minutiae of people's movements? What right do medical experts have to dictate economic policy? All you have done in this article is taken a position and then attributed thinking errors to those who don't share your opinion, while exempting nurses, doctors, postal workers and grocery workers. Your position seems to have been arrived at on the arbitrary and subjective determination that a 3%, 2% or 1% mortality rate justifies the current response. You're feeding the moral panic of those who think that those who disagree with the lockdown and social distancing restrictions are selfish, hateful, irresponsible, irrational extremists. The author actually gave a polite reply to my comment. I didn't change his mind, but I wasn't expecting to. But anyway, the whole problem with this article demonstrates the problem with clinical psychology as a whole. As I mentioned in the last paragraph of my reply, the author simply took a subjective and arbitrary position and then chose from a list of thinking errors or cognitive distortions and applied them to everyone who doesn't agree with him. This is designed to undermine his opponent's confidence in their judgment and make his subjective arbitrary opinion seem rational. However, as I demonstrated, two can play at this game. I turned the tables on him. I came to my own subjective and arbitrary position, chose from a list of cognitive distortions and applied them to those who agree with him. Cognitive behavioural therapy, or CBT, is considered an evidence-based approach. It apparently has the highest success rate of all forms of therapy and is often touted as the gold standard. One of the aims of CBT is to identify and correct cognitive distortions. Yet a 2014 study revealed that CBT was only half as effective as it was when it first came out. What is the reason for this? Well, in a therapy session, your psychologist will listen to your problems and then make a subjective and arbitrary determination about what's really going on. He or she will then try to undermine your confidence in your perceptions and judgment by convincing you that they are based on a distorted view of reality. If your psychologist succeeds in getting you to doubt yourself, he or she will then try to replace your goals, desires, worldview or values with the ones that they think you should have, all the while trying to make you think it's a result of your own insight. So why is CBT only half as successful now as when it first came out? It may work for some people, but I think increasingly more people can see that it's just mindfuckery, and not very sophisticated mindfuckery at that. It's internally inconsistent and irrational, and cannot withstand even cursory scrutiny. I hope to make a more in-depth critique of therapeutic techniques in future videos, but if CBT is the strongest treatment psychology has to offer to meet the oncoming tsunami of anxiety, depression and suicide, then we're fucked. And sadly, I don't know what the solution is. It simply would have been better never to have gone into lockdown in the first place. But I suspect that a lot of people will just end up getting medicated. The psychological establishment has a lot to answer for. It fueled mass hysteria and moral panic. It pathologized anyone who is critical of or non-compliant with the lockdown, social distancing restrictions or hygiene guidelines. It has played an active role in supplanting democracy with a medical dictatorship or scientocracy, and it has engineered a mental health crisis and demanded funding to treat it with a snake oil cure. You could almost be forgiven for thinking that they were trying to drum up business for themselves, perhaps so that they could reshape society the way they want it. Anyway, I'll leave it there. If you enjoyed this video, please like and subscribe, and I'll be bringing you another one soon.